So we took over 1,000, about 1,059 patients with colorectal cancer, again seen at the Dana-Farber Cancer Institute, all of whom had germline DNA collected and all of whom had clinical data available based on their clinical care. And we performed germline genetic testing to evaluate for pathogenic mutations in 25 different cancer susceptibility genes. Ultimately, we found that 10% of patients in our cohort had pathogenic mutations in one or more cancer susceptibility genes. We found a 3.1% prevalence of Lynch syndrome, which fits with what's seen in the established literature. Reassuringly, virtually all of these patients who had Lynch syndrome had tumors with high-level microsatellite instability and mismatch repair deficiency, more or less illustrating that our current processes for identifying Lynch syndrome among colorectal cancer patients seems to work. If you do universal tumor testing, which is endorsed by the NCCN right now, you really should pick up the majority of patients with Lynch syndrome. What was novel about our study, however, was that we found 7.1% of patients with colorectal cancer actually had a mutation in a non-Lynch syndrome cancer susceptibility gene. And these are patients who wouldn't be picked up by typical tumor testing because tumor testing really just looks for evidence of Lynch syndrome. The most common, at least high penetrance finding that we found in this cohort beyond Lynch syndrome, surprisingly, were mutations in BRCA1 or BRCA2. And these are genes that are not traditionally linked to risks of colorectal cancer. So we need some more information, I think, to help us understand what to do with these types of results and whether or not a germline BRCA mutation found in a colorectal cancer patient has the same significance as a BRCA mutation found in a breast or in an ovarian cancer patient. But I think what it shows to the community oncologists is that tumor testing for Lynch syndrome seems to work well, but we really can't stop there, and we need to think beyond just Lynch syndrome when we're looking at colorectal cancer patients.